The more you diet and exercise, the more loose skin you may have. Exercise helps build muscle and burn fat, but does not tighten skin. Even if you lose that extra weight and become more fit and healthy, you may still not be happy with how you look. And we see it a lot. I see patients just like the other day who came in, and she was so happy that over the last year and a half, she had lost almost 100 pounds through exercise, diet, eating right. And she felt like a new person. She'd gotten off some of her meds that she had been on for blood pressure and things like that. And she was just enjoying life because she had more energy. And because when she woke up in the morning, she just felt better. And all of that would end with the moment she stepped in front of the mirror or stepped into her closet and began to try on clothing. While she was dramatically smaller and while she felt dramatically better about herself, she didn't feel great about how she looked. In fact, she still felt like the person she was before with the extra 100 pounds. And we hear that a lot. I used to hear that a lot when I did a lot of post-bariatric body contouring, meaning after patients would have the stomach stapling or the gastric bypass, they would lose 150, 200, 250 pounds. I mean, extreme weight loss. And they would come in and say they didn't feel like they had lost the weight because they had so much excess skin just hanging everywhere. And that brings up a great point. You know, obviously losing weight makes you healthy. Getting off medications makes you healthier. And, you know, lowering your blood pressure, lowering your blood glucose levels, decreasing insulin resistance, all of these things dramatically improve your quality of life. There's no debating that. Decreasing the amount of visceral fat, the fat that's around the organs inside your abdomen, again, has been shown dramatically to improve life expectancy and survival and quality of life. But the thing that you cannot do on your own is fix the loose skin. And what I was going to say earlier is that brings up this point of I see patients in the gym all the time, and they're working hard and they look great and they're putting in the effort, but they're embarrassed. They have skin hanging from their arms or their thighs, or their neck is beginning to drop, or their tissue is just deflated and dropped. And although they're healthier, and you would think they would be ecstatic, and they've made such a great journey and progress, and they deserve so much credit, when they step out of their bed in the morning and they go to take a shower, or they go step into their closet and go put on clothing, and they have this new vision of themselves because they've lost the weight and they feel so much better and now they want to look better. But when they put on the clothing, they don't. They're embarrassed. And they still feel like that same person 200, 250 pounds ago. And even in a less dramatic way, we see it all the time. I saw a patient a week or so ago who had lost 40 pounds, just changed their lifestyle, diet, cut back on alcohol, exercise, all of those things that we know work, but take a lot of discipline and a lot of effort. And we all know it's not easy. It's hard. So when you do that, you make that commitment, you put that effort in, you go through all of that hard work, and you lose the weight, and you're still not happy. You're still looking at yourself like this person who you don't recognize who you are. And the common thing that I hear from patients on a regular basis is, I don't look like I feel. So the things that people say to us today, I ask patients 3 questions when you come into our office. Number 1, why are you doing something now? What prompted this? Because again, most of these folks are in their at least 30s, 40s, 50s, 70s. What now? Why are you doing it now? Number 2, why'd you choose us? I'd always like to know how you ended up in our office. And number 3, and perhaps the most important, is what's going to make you happy. A year from now, if you look back and you look at that journey that you went on when you came to us and had surgery, what do you want to see when you look at yourself that you're going to say, I'm glad I did this. I'm happy. What is going to be different a year from now when you look in the mirror or try on the clothes or go to the beach or on the boat? What's going to be different that sitting here before starting this process was bothering you? Because that's ultimately comes down to 2 things. Number 1, patient expectations in me doing my job, which is to figure out the safest, most effective way to meet the patient's expectations. Because if I don't meet your expectations, you're not going to be happy. We could do the best surgery in the world, but if it's not what you wanted, or it doesn't get you the result you thought you were going to get, you're not going to be happy. And I've seen it a lot. I've seen results the other way where patients come in and I think to myself, man, I want to fix this scar, or God, I want to do this a little bit better, tighten it up more, the skin loosened. The patient's happy. They're like, I'm happy as can be. This is more than I expected. Comes down to expectations. Unfortunately, the opposite happens when patients come in and I didn't think this was how it was going to be, and I didn't expect this. And, I think if that's the case, then we didn't do our job on our side, and that's on us as an office and as a surgeon. And I see patients come from other places who've complained or blamed the doctor when in fact the surgery looks good. The surgery went okay. But what you expected you were going to get wasn't reasonable. Or the surgery or approach or procedure wasn't the answer for what you needed. We see it all the time. Patients go to medical spas and have treatments to tighten skin. They've lost 100 pounds and they go to a medical spa and they're going to hook them up to a machine. And it may improve it 10, 20%. But if you're looking to go from having hanging skin to straight, tight arms, legs, belly, breasts lifted, you're not going to get that result with non-invasive or minimally invasive. The patient's going to spend time and money and they're going to be unhappy. So again, it's expectations are crucial. I think it's amazing when somebody goes on a weight loss journey and just improves their quality of life. They feel better, they're healthy, and they're enjoying life. We want to help you. We want to be that last step to complete the journey. If you let us help you with that, then you spring out of bed, you feel better, you're excited, you run to the closet, you put some clothing on, and you go to the beach, or you go get on that boat, or you just go down to the pool with your kids and you enjoy it. You're not self-conscious. You deserve to be happy. Don't let anybody tell you differently. Don't let anybody judge you for that. You go out and do what's best for you.